5 skin conditions that flare up every summer. Your skin doesn't just act up in summer, it's reacting to a lot of things happening at once. More heat, more sweat, more sun, more bacteria. That combination is why the same conditions flare up every year. And here's the thing, most people are treating them completely differently. So let's work on fixing that. Let's start with number 1, a heat rash, also called miliaria. This happens when your sweat glands get blocked and sweat ends up trapped underneath your skin instead of evaporating like it should. That trapped sweat causes those small, itchy red bumps that you've probably seen pop up on your chest, back, neck, or under your chest in those areas, especially during hot, humid days. It's most common in humid climates, but really it could happen anywhere sweat gets trapped against the skin, like in skin folds, under bra straps, or underneath tight workout clothing. So, what's the fix? The fix is to stay cool in the first place. Wear loose, breathable fabrics like cotton, take cool showers to rinse away sweat and unclog your pores, and avoid heavy occlusive creams or lotions that trap even more moisture and heat against your skin. Number 2 is folliculitis, which I like to call sweat acne. This one gets misdiagnosed constantly because people mistake it for regular acne, a heat rash, or even bug bites. It's actually caused by a combination of sweat, friction, and bacteria that get trapped inside your hair follicles, and it usually shows up after workouts, after long days in swimsuits, or time spent in tight clothing that's synthetic that doesn't let your skin breathe. You'll notice small red or white bumps clustered around your hair follicles, often on the back, your chest, your thighs, or your buttocks. Now, how can you manage it? I always tell people shower as soon as possible after you're sweating instead of sitting in your wet clothes or sweaty clothes. You could always use a benzoyl peroxide or a salicylic acid wash or wipe on the affected areas, and try to avoid those tight clothes that trap sweat and bacteria against your skin for long stretches of time. So number 3 is melasma, or the sask of pregnancy. It's a sun-triggered hyperpigmentation, but more than that, it's actually a disorder of inflammation. So anything that inflames your skin can actually cause your melasma to come out, whether that's heat, sun, hormonal changes, irritation, and all of a sudden you'll start noticing these darker brown patches that typically will come up on your forehead, your cheeks, and your upper lip. It's one of the most common complaints we hear about in the summer, and it can take months for the damage to go away. So, what is the fix? Well, it requires real consistency and an understanding of why you have it. Okay, first of all, you want to make sure that you're using a broad spectrum sunscreen of at least 30 or higher. Make sure that you're reapplying it, and make sure that you're putting that on because the sun is an inflamer. Also, antioxidants like vitamin C's can work in the morning. And then I always like to use a skin brightener, especially during the summer month, if not year round, to help prevent some of that pigment from coming up. So if your melasma is stubborn, which is like most people, and it's not responding to just at-home care, one of the most effective in-office treatments we have are peels. There's different kinds of chemical peels. If you don't respond to regular glycolic acid peels or salicylic acid peels, you could always use a Cosmelan peel that works by inhibiting the enzymes that cause excess melanin production. Most patients see a significant reduction in discoloration in the first month, though it does require diligent sun protection afterwards, since melasma-prone skin is especially reactive to that UV exposure, which inflames the skin. So this is not a one-and-done treatment, but it's really good for deep or resistant melasma, and it's one of the strongest tools that we have available. So fourth on our list is eczema and sweat dermatitis. This one's tricky because heat and sweat can seriously irritate eczema-prone skin, can trigger itching and inflammation almost immediately, even though people with eczema actually find their skin improves in more humid environments. The sweat itself contains salt and other compounds that can irritate an already compromised skin barrier, which is why flares often show up right after exercise or time outdoors in the heat. If yours flares in the summer, the key is rinsing off sweat quickly rather than letting it sit on your skin. Switching to a lightweight, fragrance-free moisturizer instead of a heavy one, and swapping those thick ointments out for something that still protects your skin barrier without trapping excess heat against your body is a good fix. So our last and number 5 is fungal and yeast infections like tinea versicolor, which thrive in warm, sweaty environments. These infections show up as scaly, discolored patches, sometimes lighter than your skin tone and sometimes darker or pink. We most commonly see them on our back, chest, groin areas that stay warm and damp for hours after a workout, a day at the pool, or just a hot, humid afternoon. People often mistake these patches for sunspots or dryness or eczema, and that delays proper treatment for weeks or for months. And these are not things like normal yeast infections or normal fungus. Tinea versicolor is something that's actually on our skin and tends to get worse, especially when we're more sweaty. The fix involves keeping the areas as dry as possible, changing again out of your sweaty clothing right away, and you might want to make sure that you're using an antifungal wash or cream, since regular moisturizers or acne treatments are not going to touch this. I usually will recommend something like selenium sulfide, so you could try Selsun Blue, which is over the counter, or you can get a prescription for an antifungal, either topical or a pill. Summer skin issues aren't something you just have to live with every year. They're very predictable, which means they're preventable. Now that you know the why, maybe you can fix instead of guessing every summer.